We're a discount medical plan. We are currently a national product, started here in Nebraska and have pushed out across the United States. But one of our key components of convenient care is our telehealth program. And a lot of the larger insurance companies that are out there, some offer that product. Our product is a little bit different than theirs. We have a kind of a monthly fee, and it's unlimited calls. So you get to reach a physician that's licensed in the state that you're calling from. So if you're sick, if you're in rural markets and can't necessarily get to a physician's office, it really is a perfect solution. You pick up the phone, you talk to a physician one-on-one. You can not only talk to them on the phone, but you can Skype and do all that computer stuff, where you can actually look at them face to face. The physician can write a script over the phone. They'll basically ask you where you want your script to go to, and they can send you a script to your local pharmacy. More and more, we're starting to see that that's become a real. We're exploding in that side of our business because people are looking at a lot of the insurance plans that they're going through their employers, and they may have a pretty high deductible that they need to satisfy before they can actually access care. So the out-of-pocket they're starting to see is growing. In our case, once again, it's a very low monthly fee, and it's unlimited number of calls. So you can, especially those episodic things. 70% of the stuff that you go and you see your doc for are usually those things that they can treat right over the phone. Anything that may require antibiotics or anti-inflammatories or those kind of things. A physician can ask you the right questions. They're trained to ask you the right questions over the phone. And if it makes sense for a prescription to be written, they'll do that. That's really it. Mine is a pretty straightforward. I'd like to think a little bit out of the box in the way that we pair it with a medical plan. It should not be standalone. I think everyone needs insurance. Everyone should have insurance, but it's also that it helps with that first dollar coverage. We have that plan, which is just telemedicine. We also have a national agreement with a lot of standalone urgent care centers, CVS minute clinics, Walgreens take care clinics, to where it's at a different plan level. But once again, if you don't have insurance or know people that don't have insurance, that'll provide them at least a visit that we take care of for a small copay. So telehealth, as well as just those for all those episodic needs that you may need. You can't get into a doctor right away. I flew through that. I know that. Any questions on telehealth and what it can and cannot do? Awesome.
Question: how is it different from the online, like virtual and stuff like that?
Well, virtual, most of the time, those kind of don't allow prescriptions to be written, right? Mm-hmm. The other thing that we see is, like with the traditional teledoc kind of models, one of the things that we see with those is that it may be a low upfront cost as far as maybe if they pair it with insurance, but then it's usually a $29 or a $39 visit fee. Ours is, Phil, help me out, $10 a month.
Seven for members.
$7 a month for members. That covers a family of 6, and it's unlimited calls. So once again, get on the phone and call. So to me, it's a no-brainer as far as to pair with a good insurance plan, and it takes care of a lot of those first dollar needs.
And can you join anytime throughout the year?
Anytime. Because we're not regulated by the insurance. It's a very good question, by the way. You can join anytime you want. You can opt out within 30 days if you don't like it, but you can opt in at any time. Great, thank you. Whoever's jumping in next.
Okay. So I'm Jessica Colo. I work for Medica Health Plans. We also have Todd over here. So he's an agent with Farm Bureau. So I'm just going to talk about the new member health plan with Farm Bureau in Medica. So I'll introduce Medica a little bit here for those of you that aren't too familiar. Right now in Nebraska, Medica sells individual and family plans. So people under 65 who might not get health insurance through work or choose not to take it, or in between jobs, something like that. And for 2019, we decided to partner with Farm Bureau to make an association plan to help farmers and ranchers have a more affordable healthcare option. So in order for that to happen, there's a few requirements. 50% of your income, your gross income, has to be from either production agriculture or agribusiness. And then if you have employees that want to join the plan underneath you, they have to work at least 30 hours a week, so that qualifies them as full-time employees. If you're an employer with 50 or more employees, this wouldn't be an option for you. It has to be under 50 employees. If you are not a Farm Bureau member, but your employer is, you can still sign up for the plan. So these plans, we can't ask any health questions, so it's not underwritten. So compared to some of the other, co-op plans, or I know the new gravy plan is out there, I would just encourage to look into the benefits, not just the premium. So your monthly premium could be cheaper, but just make sure you're getting that coverage that you need to get. And if you have questions, the way you enroll in this Farm Bureau member health plan is through your agent. So talk to your local agent. They're trained on these plans and also the regular under 65 Medica plans. So if your income falls in those guidelines where you can receive government subsidy or the financial assistance, then those plans could be a cheaper option for you as compared to the Farm Bureau plans. So that agent can help you kind of work through that and see what the best option for you is. You have anything to add on that?
No, you guys, as I've worked with 2 people already today and working with a third one this afternoon at 2 o'clock. Base is something that I've worked with. I'm working with a small group tomorrow with Base. Community care is a great member benefit, as most people, I think you're gonna see that kind of be a primary care, I mean, really kind of run alongside primary care physicians. Is most everybody going through the market? Is it, who here, the 3 basic platforms are the getting it through a spouse, getting it through the marketplace, either subsidized or unsubsidized, or everything's been on the table the last couple of years, right? A Christian community plan. Is everybody on one of those 3, or what's most everybody got? They're all going through the marketplace in some degree? Yeah, and so as I've worked with some people here, that's the scary part, right? I mean, because to get any type of subsidy, you're trying to estimate, for example, today, you gotta estimate what your income's gonna be in 2019. That won't get figured out until April 2020. And so as I've sat down with most of my farmers, they are just something as simple as this soybean, kicker that Trump threw on. How's that going to fall into that deal? And if you aren't best friends with your accountant, you better be real quick. And because a guy that I worked with last week on it, I throw out everything on the table for my people, as you should. Give them all the options. The whiteboard is what everybody provides. Then it's my job to run the play with the people. And so I always throw out the marketplace, and that guy about jumped across the table and said, he got stung 2 years ago. His wife had a pension plan that they had to cash out about $18,000 to take care of a penalty that came because the income was off, right? Well, oops. And I wasn't working with him at that time. That $18,000 cash out on the pension, guess what that did the next year? It wasn't deductible. So that threw his income off again. He paid over $30,000 in penalties over 2 years. And so that's really the scary part. Most of my guys that I'm working with, they have, as we all know, prices have come down. They've kind of entered that marketplace looking at that subsidy side of the coin. The scary part is how is it going to get figured out now in about 3 months or 4 months? That's the part everybody is really nervous on, and our experience has been with this Farm Bureau Medica plan that on an ag producer side, they're getting between 20 and 25% discount already. So it's like getting a 20 or 25% subsidy and not having to play any of the subsidy games. And so I think it's been well received.
So you're not limiting your income at all with your
Bingo. Yeah, we're not. This is all this. The reason, and again, I'm a little bit over my skis a little bit on how this was designed, but I can tell you what the flaws of the marketplace is. 40% of the people that buy it, dump it by May 1st, that affects you on your rates. Most of us buy it 12 months out of the year. When you get somebody that buys it, when half the people buy it, dump it, that destabilizes the premium, right?
Why did they do that? Because I thought you get a penalty.
Well, not when you do it after April 15th. And you use it, right? Then they dump it. then they jump back in January 1st, get around the penalty. Okay. Also, little side kicker was all you have to do right now, I think this year there's no penalty. Okay. And then the third thing is the federal government side. For 2 straight years, the federal government messed around with how much subsidy they would actually pay back to those companies. And all of a sudden, they're expecting, to get X number of dollars from the federal government to offset medical costs. And for all of us that have been around in that marketplace market, we've seen this huge cafeteria plan of multiple companies you can pick from, right? That's what was promised. Well, first the website was supposed to be this wonderful place to go. And then it quickly came to, thank you, Jessica, for being the only company left in the world that wants to do any type of insurance with agricultural self-employed people. So I have some people that have looked at some of these other alternative plans, like the Christian Community or MediShare. Those all sound good. I think there's some interesting parts as I've digested that. There's some interesting parts that I think will be portable towards helping healthcare in the future, but you can't deduct that. It's not a traditional healthcare plan, so every penny you pay in premium into that, you cannot deduct off your income taxes even through base. I've already checked. I thought,
There's
well,
no guarantee they'll pay your claim.
absolutely, and so also, it's a meta share, okay, and that's not an that's not an uncommon practice, right? That's how insurance companies started. That's how Farm Bureau started 75 years ago, or 80 years ago now, Steve, isn't it? Somewhere around there. It was a small association of Farm Bureau members. Well, we've gotten bigger, and that's how insurance creates stability in the product. With that comes all the other things that create cost as well. So, I had high hopes as I've sat down with people. I'm sure you guys all do. I'm meeting with a guy on Friday from Sutton that is, he's spending him and his wife are in their 50s and spending $35,000 a year to have the luxury of a $13,000 deductible.
Affordable care Act.
It's affordable, right? So, and that's on, unfortunately, him and his wife make too much money. Him and his wife net about $100,000 a year. They're not in the agricultural side, but they are self-employed construction, and she works for a company that doesn't provide health care. So, in a small town, which is a great deal small town, so it's real. The pain is real. As I sat down with one of my farmers yesterday, the insurance is slowly taking over property taxes, Steve, so there we go. We got a new stick to swing right now. So, I would highly encourage getting with your local Farm Bureau agent. Most of them are highly educated right now. It's dangerous with an insurance agent, right? But most of them are highly educated with this healthcare because they've lived it.
I got a question. The guy that farms my parents' land,
Correct.
he gets his health insurance through his spouse.
Okay.
He has 2 full-time employees and a couple part-time employees. Can he buy the insurance and provide it as a benefit to his employees?
Yep, so is he a Farm Bureau member?
Yes.
Okay, so if he wants the insurance, he can. If he doesn't want the insurance, he can still offer that to his employees. And if the employees are not Farm Bureau members, they can use his Farm Bureau ID.
Really?
Yes, so he doesn't have to take it.
Okay, is there a threshold for the part-time employees? They're seasonal.
It's average, right, Jessica? A lot of them go off of average of 30 hours a week because, as we know, farm isn't 30.
Yeah, the actual requirements that we have are no part-time or seasonal workers, just full-time as 30 hours per week.
Mm-hmm.
Or if they meet the minimum wage guidelines for the year, if they're making $11,310 throughout the year and they can prove that on their W-2, then that also qualifies them.
How much?
$11,310. Yep, so,
How did you come up with that number?
That's the Medicaid number.
is it?
Right, yeah.
Okay.
That'll be the state Medicaid number, or the federal Medicaid number this
So
year.
if you're under that, you get Medicaid.
Well, no, next year maybe. How's that gonna work, Steve? With we just passed it, right? Yeah. That was that Medicaid expansion thing, right? That was the paper.
Yeah, that's
You
a
know,
whole nother.
That's a whole nother can of worms there, but that's what the federal determines as Medicaid. State of Nebraska is what, 3,000 or 4,000 right now, so that was that expansion thing that you see was a big topic, so that's how they came up with that number, I'll bet.
Thank you.
Yep.
So yeah, what they would need to do, the deadline is December 12th. So that's the big number. It was December 1st, we pushed it out. So,
Okay, so I'm gonna ask one more
Yeah.
question, Jessica, I would appreciate it. So Seth is the guy who farms our land, so
Okay,
if he's he is a member, he's been a
Yep.
member a long time.
okay,
So even if his part-time employees aren't members, they could go under his membership?
Correct.
yep,
That's the only way they'll get it, yeah.
Yeah.
Yep.
yep.
Okay.
Or if any of those employees have their own farm,
Yeah,
and 50% of their income comes from that, then they can do that as well.
okay.
But they would, in that case, they would have to be
They
their
would
own.
have to be members.
Yes, yeah,
So you
as
have
of
to
July
farm.
1st.
So you have to farm.
Well,
Yep.
to be part of the Farm Bureau plan, you do, yes, or agribusiness, 50%
Yep.
of your gross income coming either from farming or ranching or from agribusiness.
So like if you work at a feed store or, anything that's an essential, business to farming, that would qualify as agribusiness. So yeah, December 12th is the deadline this year. And then we do allow special enrollments throughout the year. So that could be new employees coming on, if you get married, you get divorced, change in household, have a baby, anything like that would qualify to join this plan.
And Seth has a son, he can be insured up to age 26, is that, it's Affordable Care Act compliant?
Yep.
Is that how that all works?
Yep, so his son could be on his plan. Is that what you're asking?
Yeah, that's exactly what I'm asking, until he turns 26.
Yes. Yep, so these are individual and family.
Yeah.
So if the employee has a
He's
family,
covered, but I just thought I'd ask the question.
Yeah.
There's options, right? Because the guy I'm meeting with at 2 o'clock's got a 24-year-old daughter that's out of school, and he wants to see if, with her starting her job, whether she could be maybe on the marketplace.
right?
The marketplace is fine as long as your income is stable. Where my ag producers are just putting their head in a rat hole right now is just trying to hit that number with all the, I had them, I didn't know, I just said, boys, gals, this is where I leave the boat. Because I think this is such a dangerous topic of playing that subsidy game in the ag world, because you are estimating today that won't be figured out for 16 months. And the federal government has no sympathy. $10,000 of net income could be $15,000 of penalty. Not penalty, but basically return subsidy.
Yeah. Another thing with the Medica plans, and this is all Medica plans, we have the travel program. So say you have a son or daughter that's going to college in Minnesota, you could still have them on your plan, and then they could use the travel benefit in Minnesota. So that's another thing to keep in mind, versus having them buy their own health plan that covers them up there.
So they're still considered in-network?
Yep, so they're in network. We have some plans that are tiered, which just basically means, tier 2 providers will be a little more expensive, and those travel benefits fall into the tier 2 category. But yes, we have, it's under multi-plan, and these providers are contracted to be in network.
The penalty that you talk about on a subsidized marketplace, is the penalty just the return of your subsidy, or?
Yeah,
is
and
there
the penalty's kind of a
penalty
tough word for it. It's more of just a return of the subsidy, because a subsidy is based upon your net income scan, depending on how many, one spouse, children under 26, up to 6 people, and they bump that net income, I think right now it's about 45,000 or something is the single person. So let's just say we're talking a single person, and that single person has, and I have, guys that work at Mead Lumber, in Crete, and he makes net $28,000. Well, boom, that says, hey, your premium would be $1,200 or $1,500 a month. We're going to allow you to have up to, say, $1,000 or $1,100 of subsidy, which he can then decide how much he wants to use. And then, but let's say he takes all $1,100 and he inherits grandma's Camaro and sells it, and all of a sudden his income shoots back up to $45,000. Well, the federal government says, through the IRS, through the tax return says, hey, that $1,100, yeah, we want it all back. And the real danger goes back to that Medicare expansion, okay? Because if you happen to, I have a gal that owns a convenience store and in a small town, and she flirts with that Medicaid expansion gap. Well, all of a sudden, what could be almost an 85%, with her, if she makes $14,000 net, she might get 85% of her health care paid for. If for whatever reason that drops into $8,000 underneath that Medicare expansion number, it's all returned.
You get that 1095A form.
Yep.
At the end of the year, let me just tell you, they catch it really fast.
They're
They catch
looking
it
for
very fast.
A lot of it in concept, I've done health insurance for 20 years, you know, a lot of it in concept I really thought was unique and probably had, number one reason why somebody 62 years old wouldn't retire is healthcare, right? And as Jessica can probably attest, and I got a 25-year-old daughter and a 20-year-old daughter, I wish they were boys and could be electricians, you know, they'd make a boatload of money. But being a girl there, it's really tough, you know, and so getting jobs, right? And so I really thought that this subsidy thing would help early retirees as guaranteed health care, which people didn't have before. So if I could get an early retiree to get guaranteed health care, they have their income reduced, maybe they get a subsidy, because as any of us that paid for insurance premiums prior to this healthcare.gov, it was obscene what they would charge a 62-year-old. Not obscene, it was rated, you know, actuarially figured out. And so, but the young person fought to get a job at entry level. Well, if they could get those early retirees that wanted to retire, that were only keeping their jobs because that's the only way they could get health care, it just opens the door to so many more possibilities. And as usual with the government, they screwed every last bit of it up. And I thought this year they might actually pull their heads out of their butts and fix it, and they can't even get a Supreme Court guy put on the thing, let alone fix healthcare right now. And so I can tell you, if you're not a Farm Bureau member, you should. As Steve will tell you, I don't get paid a single thing by selling a Farm Bureau membership until you buy insurance, and then we're in business. But everybody should be a Farm Bureau member that's in agriculture, because you guys spent how many tens of thousands of dollars getting this thing onboarded for agricultural folks. So it's a great deal. Nobody else is doing it. The Nebraska Bar Association is the only other group that I heard that did it. I know some co-ops were looking at it, and I think once they ran into all the headwind that you guys had to face, they said, the hell with it, we're gonna sell fertilizer and chemical, and you guys worried about health insurance, so.
And I've personally used Medica, and they're outstanding.
Yeah,
Really
they are.
Yeah, a little background on Medica. I know, so we're working to build the trust up. That's one of the main things that Medica does. We were originally based in Minnesota, North Dakota, South Dakota, and Wisconsin. And then in 2016, they decided to expand into Iowa and Nebraska. And then in 2017, added Kansas. And now for 2019, we expanded into the entire state of Oklahoma and Kansas City, Missouri, so just across the border. So we have a regional office in Omaha, which we decided to put there when we expanded because it's just more centralized, and that's where I'm from. With adding the Farm Bureau health plan and just helping to build all of that trust and just get the name more familiar. I think the biggest thing with this Farm Bureau member health plan is getting the word out and teaching people about it, and especially people that qualify and don't know that they qualify for it. Yeah, if you're not a Farm Bureau member, definitely join. I'm joining. I'm excited about it. So, yeah, July 1st, 2019 will be when you have to join for next year if you're not a Farm Bureau member now. So keep that in mind. Also, if you're an employer, this can be a perfect marketing opportunity for you to keep employees on the farm, to get more employees on the farm. You can tell them, you offer health insurance, which is huge.
Guy I met with this morning runs a feedlot, and it means everything to him. And base, I think you need to be recognized. It's a benefit. It's a cheaper benefit than you can get through some of the other places, but they're able to get their spouses' healthcare premiums deducted out of their paycheck tax-free with that base program. He also kicks in extra money for other things that they may need medically, whether it's vision or dental and stuff like that. They run it through that base plan, through the payroll, and it's as everybody is that runs a small business, when you can't provide these expansive benefits to people, it's something like that base that allows you to kick like he's kicking $500 a month in through that base for his 22-year-old outlaws that not only hate the government, they hate the government healthcare system. So he at least can provide them something to. They're not getting a kick out of those kids all the time, but he can at least provide them something that can get them some type of health care and allow them to do it with tax-free through that base. So, yeah.
My name is Adam Harrington. I'm from Benefit Administration for the Self-Employed, commonly referred to as BASE, just because no one likes to say Benefit Administration for the Self-Employed. Very long name, but so yeah, we go by BASE. We're a third-party administrator. What we do is after you've made a healthcare choice, doesn't really matter what healthcare option that you've chosen, is we help business owners design the back end of that to either make the premiums tax-free that the employees would pay in that situation that you had there on the farm, those employees, so they can come out of their paycheck, those premiums, on a tax-free basis, which obviously will save them federal income taxes, state income taxes, Social Security, Medicare taxes, those types of things. Or what we can do is we can work on a little different avenue too, to try to get their out-of-pocket non-insured medical expenses deductible from a business tax return, either from a farm on a Schedule F or on a corporate return. So there's a lot of different advantages that you can do after the fact, after you've made that healthcare plan choice, to actually make your non-insured medical expenses, deductibles, copays, prescriptions, obviously a huge medical cost, tax deductible from a business. So we have a multitude of different plans and different types of arrangements that can fit certain situations. One of them that I'll talk about that fits very nicely, probably our biggest seller. It's an ACA exempted plan. It's known as our Base 105 HRA. It's for just one employee, excuse me. So if you have a farm situation, or even with these Medica plans, if that farmer chooses to choose the Medica plan and it's just themselves or their spouse, what they can do is they can incorporate a Base 105 HRA. And now what happens is all those deductibles, copays, prescriptions now become a tax write-off on the Schedule F or on the corporate return, depending on how they file their income taxes, as a write-off for their business, whereas it wasn't before. So that plan has been an ACA exempted plan. What that plan does, our average tax savings in the state of Nebraska alone is over $5,000 in tax savings per year. So it's a huge benefit on top of what you can do from an insurance perspective as well. So you have that option. We can help write off, make employees' premiums tax-free, like I mentioned before. There's different ways where if an employer doesn't want to offer insurance but wants to give them basically a tax-free stipend, there's different things that we can do for that as well. So just a multitude of different things that you can do after the fact to help you from a tax perspective. So that's really what we specialized in. We're located just outside of Des Moines, Iowa, just this side, about 10-15 miles in Adel, Iowa. So traveled over here this morning, traveled back right after this. So a quick little drive for us. But we're Farm Bureau Nebraska member benefit as well. We do have customers in all 50 states as well. So we are a nationwide company. So with that, I'm going to open it up. See if you guys have any questions from a tax perspective, what you can, can't do. Any questions that you may have there?
So you're a Farm Bureau member benefit.
Yes.
Is your service included in the Farm Bureau Medica plan, or is it an add-on?
It's not included. If you're a Farm Bureau member, there are some discounts that do get provided on the fees.
Okay.
And moving forward, that's something that Medica's gonna look into also with BASE to see how, we can get the word out more on the benefits of pairing these two together.
Yeah.
So it just makes sense, right?
Yeah.
And I'm not licensed or anything, but I see there's a tremendous benefit for the guy who's trying to keep people in his employment, that he's farming my parents' land and a lot of other folks, and I'll get him to the right people, but
Right.
I'm just trying to figure out as much as I can to help Seth get it headed in the right direction. So yours is an additional fee, but yet it still sounds to me like it's an incredible service, to help them with the tax deductibility and just record keeping and things like
Right.
that.
So if those employees, if they get the health care, they choose it, then obviously that premium, they partner with us, that premium that those employees will pay will be pre-tax out of their payroll. So obviously not gonna pay any payroll taxes, but also then the farm doesn't have to match payroll taxes as well. So the farm actually saves in income taxes as well. So it's a win-win on both sides of that equation.
Okay, thank you.
Cafeteria plan is what you commonly hear that called, right? Your cafeteria plan, you hear people that work for employers that say, I got a cafeteria plan. That's essentially what that is. That's available to an individual, not a company. Sorry, didn't mean to interrupt you, sir.
I was just wondering about HSAs, are your plans all HSA
Yes.
compatible, and also does that, if you if you were in a subsidized marketplace plan, does that affect, your HSA in any way?
Right, so, for the Farm Bureau member health plans, there's 3 plan options. There's an HSA option, there's a copay option, which just has more copays for services, and then there's a deductible coinsurance option, which has coinsurance amounts for services. So if you have an HSA set up right now, so a health savings account, I know I'm on one as well, then that does transfer over. And any HSA administrator, so any bank that you go through, anything like that is accepted. And then if you're currently on a subsidized Medica plan, I would check the premiums to see which premium is gonna be better still, but that HSA will transfer over. Does that answer your question?
It's the same thing, you can still get all your HSA benefits that you currently get on this plan, absolutely. Every one of them.
Does that help answer?
Yeah, I was just worried that, if you fell under that 48,000 or whatever it is, or you could get it down there with the
Mhm.
adjustments and that.
Yep.
And so you qualify for a subsidy.
Yep.
I was wondering if I had to, if you had to check on anything with your HSA, cause I have an HSA and, you know, I don't know if you were limited to what you can contribute to an HSA or something based on your.
Based on that subsidy mark?
You're gonna have to check with your accountant on that deal. My perspective's always been, and I've been in HSAs back, they used to call those MSAs in the old days, medical savings accounts. And my perspective with my accountant and doing the research that I've had is they, you need to check with your accountant on the thing, but they have not been I mean, people that I've talked to have been audited they're a lot more concerned about income than they are those receipts, but I would just keep your receipts separate. Most of the banks have a separate, debit card or something like that, but,
Well, I don't even use mine, I treat mine like kinda like an IRA.
Yep, which you can roll those over one time in your life to a regular IRA, yeah, they're great, using for long-term
But
care.
I'm just wondering about the contribution.
You have to check with, the contribution amount should stay the same even if you're subsidized, I do know that. Contribution amount is the same because that's exclusive than the subsidy. Because technically, the subsidy is not, you're not getting a cheaper premium, you're just getting some of your premium paid by the Affordable Care Act. So you can still keep your contribution amount the same, whether it's individual or joint, regardless of whether you're subsidized or not, or regardless of whether you go to the Farm Bureau plan that is technically rated differently than the marketplace.